My name is Ethan, and I am here on behalf of the East of England Cancer Alliances to talk to you about active surveillance for early prostate cancer. In this video, I will explain what active surveillance means, why active surveillance may be suitable for you, who is eligible for active surveillance, what active surveillance involves, the risks, advantages and disadvantages of active surveillance. What does active surveillance mean? Active surveillance is a program of monitoring prostate cancer that is contained within the prostate and with a very low risk of metastatic disease, which means you are unlikely to experience spread of your cancer. This is called early prostate cancer, and in the UK, refers to cancers classified as Cambridge Prognostic Group 1 or 2 by the National Institute for Health and Care Excellence. This may be also referred to as CPG1 or CPG2. Some men with higher CPG may also be eligible for active surveillance. The aim of active surveillance is to avoid treatment, unless the cancer develops to a stage where it may cause you harm, and hence, you would benefit from treatment. Formal comparison studies have found active surveillance to be as good as immediate treatment, such as surgery or radiotherapy. So, you may be asking yourself whether active surveillance is suitable for you. If you have CPG1 or CPG2 disease, then active surveillance is a recommended option for managing prostate cancer by the National Institute for Health and Care Excellence, also known as NICE. To read more about the NICE recommendations, you can access the East of England Cancer Alliance website at www.canceralliance.co.uk/prostate, or use the QR code at the left of the screen by pausing this video. If you're not sure about whether you're suitable for active surveillance, or it's right for your type of diagnosis, the Predict Prostate web tool may be able to give you more personalized information on the benefits and risks to help you decide. You can access it at www.prostate.predict.cam or use the QR code on the right side of the screen. By pausing this video, Predict Prostate is intended for men with non-metastatic prostate cancer who are deciding whether to go onto active surveillance or have treatment. Nothing can ever tell an individual man exactly what is going to happen to him in the future. But Predict Prostate will provide a realistic estimate or best guess about the potential survival benefits of different treatment options. Who is eligible for active surveillance? Men diagnosed with Cambridge Prognostic Group 1, where a prostate-specific antigen, referred to as PSA in short, is less than 10. Biopsy shows grade Group 1 and clinical stage T1-T2, or Cambridge Prognostic Group 2, where PSA is 10 to 20. Biopsy shows grade Group 2 and clinical stage T1-T2. Some men with higher CPG may also be eligible for active surveillance, and you can speak to your healthcare team about this. There are a few other factors such as age and how big your prostate is, the extent of tumor on magnetic resonance imaging scan, or MRI scan for short, and how many of your biopsy samples were positive with cancer. Any other medical problems you have may also be important when considering active surveillance as a choice. Your healthcare team will discuss your personal risks with you and suitability for active surveillance. What does active surveillance involve? An active surveillance program will vary from patient to patient, depending on your specific circumstances, prognostic group, and other factors. Your nurse or doctor will discuss this with you. But typically your program may have the following schedule. After you have been enrolled to active surveillance, you will be seen in a dedicated active surveillance or prostate cancer clinic for further discussion. Here, a plan on how your surveillance will be done will be discussed. An early repeat biopsy may also be discussed. You may also be invited to attend an active surveillance teaching session to get more information. Once on active surveillance, You will have repeat PSA tests, and may also have an interval scan of the prostate. The timing and frequency of these will be discussed with you by the team, and will be tailored to your particular characteristics. PSA tests are usually recommended at 3 to 4 month intervals, and a personalized plan of follow-up will be arranged. Typically, this will involve PSA blood tests which can be done at your GP surgery. It's always a good idea for you to keep a record of these results yourself. This may also be supplemented by online or other tools to keep a track of your PSA levels. Your healthcare team may give you a PSA level threshold personalized to you, what it should be under, and what to do if it goes higher than that. If you don't know yours already, ask your team what to look out for. Repeat MRI scans may be done at yearly or at longer intervals, depending on what your initial scans showed. Interval scans may be requested if there are other indications, such as if your PSA levels breach the given threshold. If you cannot have MRI, repeat prostate examinations may be recommended. A follow-up review will be arranged at 6, 12, or 18 months, depending on your particular circumstances. If your PSA and scans suggest any changes, then you may be reviewed sooner. If so, restaging biopsies or changing to active treatment may be discussed with you. At all times you should have ready contact with your prostate cancer nurse specialist, who you can talk to if you have any concerns or worries. Whilst you are on active surveillance, triggers for repeat investigation or treatment may include evidence of a sequential rise in your PSA levels above your preset PSA threshold, a change in your interval scan findings, an increase in tumor type or volume on repeat biopsy, a change in your Cambridge prognostic group as a result of repeat investigations. You can, of course, also choose to end active surveillance and go onto active treatment at any time you wish to do so. Are there any risks with active surveillance? Of course, there are always risks with any type of prostate management, such as changes to your cancer. The tests used to monitor your cancer are aimed at detecting changes early enough to start reinvestigation, to see if you need to start treatment, rather than continue with surveillance. There is always a small chance that changes may be missed. Talk to your nurse or doctor about your own specific risks as an individual. There is a chance that your general health could change, which would make the value of radical treatment like surgery or radiotherapy less likely to give you a survival gain or benefit. For instance, if you develop another illness or have other reason for a shorter life expectancy, and in this case, you may be switched to watchful waiting. The potential psychological impact of active surveillance means that it isn't for everyone. You might find it difficult not to have any treatment for prostate cancer, and worry that it will change or spread. If you are worried, talk to your doctor or nurse. You do not have to stay on active surveillance if you do not want to do so. To better understand your risks and outcomes, the East of England Cancer Alliance website or the Predict Prostate tool described earlier in this video may be helpful. Whilst on an active surveillance program, you may be required to have repeat prostate biopsies as part of monitoring. Prostate biopsies do, however, have a small risk of infection and bleeding, and this risk will apply for each biopsy episode, though all steps will be taken to minimize this risk. Repeat MRI scans don't convey added medical risks, but can take time, be noisy and be troublesome for those with claustrophobia. What are the advantages of active surveillance? As you won't have any interventional treatments while on active surveillance, you will avoid any side effects from treatment. Active surveillance doesn't interfere with your everyday life as much as treatments do. If tests show that your cancer is growing to a stage where surveillance is no longer suitable, you can still have treatment with a high rate of curative success. Active surveillance is a tried and tested management option for early prostate cancer, and many studies have shown it is safe and effective for many men and is an equally good option as treatments. Hence, its recommendation by the NICE National Guidance. What are the disadvantages of active surveillance? Your general health could change, which might make some treatments unsuitable for you if you need them. Your cancer might grow more quickly than expected, but the chance that this will happen is small. Not having treatment can cause high levels of worry in patients about the possibility of their cancer growing. We hope you have found this information useful, but please always discuss your own management in detail with your healthcare team. Thank you for watching this video.